So, all right. So here's what we've got. So this presentation is about how artificial intelligence, machine learning is going to shape the post-COVID-19 world. There's a lot of stuff that's going on. We've received a lot of questions from a lot of folks about different things, how their existing models are going to change, what do they need to look at, and so forth. So I would like this to be a little bit open as well. We've got a lot of stuff that we're going to cover for different industries. We tried to make this as general as possible. But if you have some specific questions that you'd like to have me address, we'd be happy to do that. If you prefer to put messages in chat, we'll be monitoring the chat as well and give you as much information as possible. So this presentation, we're going to focus on really four key things. One is how the economy is going to reopen, and just got the information yesterday with some guidance. Each state's going to be different. It's going to be a data-driven approach. We're going to talk to you a little bit about what you should be doing instead of waiting, say, for the governors and for regions to actually act. You can do some of this yourself. We're also going to talk about something that's actually been a little bit, we'll say, unnerving for us, even though we're used to this at 5E, which is the current state of modeling, right? We're going to see a lot of stuff that's going on and some words that are said about models and skepticism. So we want to address that because we think that's important. Then as we move out of the post-COVID-19 area, or as we get into this post-COVID-19 era, we're going to have some challenges. So we want to discuss what some of those challenges are. And then finally, we're going to talk about opportunities in a couple of different areas. This may or may not be the areas that you're in, but hopefully some of it will apply. And as it does apply, you can leverage it. You can leverage some of the ideas. But if you have some specific questions, we'd be happy to answer that. So what's the current situation? As everybody knows, since March 16th, this is a big problem for the US economy, for the global economy. So based on whether your company is global, is national, or just regional, everything's going to affect you, but it's going to affect you in a different way. We're seeing a GDP decline of about 10% over 2 months, which is going to be 3.5 annual decline over the course of the year, about $2.13 trillion in lost national production in the last 2 months. Unemployment right now, we're looking at numbers 15 to 30%. Economists are not too certain as to where it's ultimately going to land, and a lot of that has to do with what Congress does. But more importantly, there's going to be a lot of uncertainty in policy. What opens? Where does it open? What if you get another hotspot? And how does this affect regions and other areas of the country or your business or a particular business? As well as trade implications. If you're looking for materials from overseas, there's going to be significant aspects there. And consumer behavior, and this is one of the things that we're talking to a lot of customers about. Really, behaviors are going to change. The question is, how long will they change for? Some folks have a very short-term memory, so they may not remember the pandemic of 2020. Others will change their behaviors permanently. And that will affect retail stores. It will affect how you handle customers, let's say, in banks. It will affect work situations and work areas, and we're going to talk about some of those. So in the current situation, there's going to be four stages of how we reopen the economy. We're going to continue to monitor virus infections, which we're going to talk about briefly. Identifying the low-risk infection areas. So as the infection rates are lower in certain areas, you can engage in those areas a little bit more, but you have to know where they are. Selected areas and businesses are going to be open. So regions of a state, regions of a county might open up, probably less likely at a county level, but it's still possible. We'll give you an example of where that might be. But certain businesses will have issues. Certain smaller retailers may have issues, but other retailers or distribution, logistics, finance companies may not have certain issues. But they will experience issues in terms of the way they can work. And then finally, there's going to be this cycle of we reopen, we monitor, we identify various cases, and then we isolate either individual or community or even slightly larger areas if it occurs again until a vaccine appears. So what we've done is we've started to model the cases, and some of you who I've been in contact with on this call know that we've been modeling it for quite a while, since really the beginning of March 16th. What we decided to do is we decided to look and slice the data in different ways. And one of the ways was by region. We actually created our own sets of regions based on some other subgroups by the US Census Bureau. And what we find is this is actually going to be very indicative of how the regions are going to open up. The New York metro region obviously has the most number of cases. it is going to be one of the last areas that really opens up in totality. But other areas are ripe for opportunity for opening. So you have your Pacific, your upper Midwest, Rocky Mountain, and then some other ones. And the region order that's here on the right is the order in which the lines appear. So New York Metro is the highest, with Pacific being the lowest. And this is critical because as you're identifying what regions to market in, what areas will be affected by your distribution channels or by your retailers, depending on where you are, this type of information is going to be critical. From a behavioral case, the mortality rates are important because the fear factor of how this affects an individual person's life or a small community is really, really important. This will guide a lot of that localized behavior. New York Metro region, we're reporting lots of deaths, and the numbers changed yesterday because of new reporting regulations. So we're going to have to reevaluate how we look at some of these numbers. But these are the types of numbers that will affect customers. And what's important is to understand in various areas what their belief is going to be about its effect on their localized population, either older population, younger population, or their workforce. So this is what we mean about monitoring virus infections. The data is publicly available, and if anybody would like a feed from us, we can provide that as well. So within our current situation, they're going to have to identify the low-risk reinfection areas. Who is going to have the highest risk of reinfection? How are they going to open up? And everybody's talking about this in a data-driven way, which means as a company, you want to get the data as well. You want to begin modeling this and comparing it to your sales. You want to see and react to the changes and the fluctuations, because the folks are going to respond to, your customers are going to respond to government and policy behavioral changes. And what will happen is that they will have a little bit of a lag from those changes. Then your businesses will have a little bit of a lag from that. So this is a way for you to begin identifying what's happening in the areas. So we think that it's geographical, regional, community-based first. Then it will be by industry and business type second within those areas. And then it will be things that will require strict changes to customer behavior. Depending on if it's distribution, depending on if it's like retail stores, such as shopping aisles that are now going one way. Does this change permanently, where you have this almost voluntary one-way movement of aisles? Do you have a single queue to go into your registers? This will affect the changes of the way customers buy, and it will affect your revenue. It will affect your profit line, because it's going to be harder to gauge what the actual effect is going to be, at least in the short term. So you want to definitely model those things. So according to the policymakers, they're going to reopen community by community. What is this really going to look like? Can you predict what could happen? And the answer to that second question is, you can predict with some degree of certainty what that might look like. Is there a risk for more hotspots leading to a closure? And that's a little bit harder to predict, but it is possible at the very least for folks who are in particular areas, who are doing business continuity plans, disaster recovery plans, or if you're looking to mitigate your sales risks, this is something that you want to look into as to which are the hot spots. And they'll be similar to the spots that are currently experiencing the crisis. They will go from smaller to larger. You're going to have to identify the smaller cities in areas that are less populous. You're going to then have medium cities in areas with smaller states, like your Des Moines, Iowa, Omaha, Nebraska, those types of things. Larger cities in smaller states, you might see areas like San Antonio open up. We're still trying to gauge about Dallas, Fort Worth as an example, because we think Texas will be one of the first places to open up. And then you'll have some other areas like North Carolina, South Carolina. South Carolina has been a very interesting case because they've really pretty much locked down a lot, but within the state, there's still a lot of movement. So Charleston, South Carolina could be open for business, and Savannah could be before Atlanta is. Larger, broader populous states will then be last. You will then see this contraction of who's opening, right? Everybody opens up, and so we're getting into smaller and smaller areas that aren't open. The major metropolitan regions that have had their big issues will be the last to open up. Your New Orleans will be last, your Detroit, Los Angeles, San Francisco, and we think New York in total will be the last to completely open. There's a lot of variables that go on into this New York issue. And when we say New York, we're referring to the tri-state area of Northern New Jersey, Connecticut, Long Island, Westchester, and New York City. This is what the map looks like as of 3 days ago. So you can see where the red is. The problem is this doesn't give you the full picture. And the reason it doesn't give you the full picture is because when you look at it at state level, like New York, you can see the disparity that occurs in terms of the number of cases. This is where we think the opportunities are for businesses. If we start looking at these numbers and we can model the decay, which is one of the things that we're doing, that northern New York region is definitely going to see 0 cases probably within the next, or new cases probably within in the next week and a half. The middle region, probably with the exception of Albany and Buffalo there, again, similar things. You're going to see a real reduction in cases, real reduction in hospitalizations. The downstate area will be a problem. But you can even go further. This is a map to the right of Nassau County. And you can see within Nassau County, there are some specific hotspots. You can see businesses probably in these areas being open very, very, very much last. Whereas other areas, they might be open, and that'll allow the population to disperse their economic activity. We've been talking internally about different things, like with regards to hairdressers or smaller retail shops and so forth. We could see them opening up. We could see them opening up, let's say, in these northern areas where they may exist. Some of these are less populated areas, so they don't have a lot of stores. But you could see those types of things happening. In Nassau County, it's broken up into 5 what are called major towns: town of North Hempstead, town of Hempstead, town of Oyster Bay, and so forth. You could see them probably open up one by one. But the larger congregated areas here in central Nassau will almost certainly be a problem. The other thing of note, and this is something for a little bit later when you're talking to your employees about how to reopen, and we had a conversation yesterday with the American National Standards Institute, is to consider how your employees get to work. One of the things that we noticed in our studies here with regards to New York and California and here Nassau, and it's specifically noticed here in Nassau, this center line here of red is one of the major mass transit areas for Nassau County. It is a popular bus line. This area in red down in the south here, that's Freeport, New York, that also is very heavily trafficked with buses as well as trains. So it's not really surprising to see some of that. Now, the converse to that is these are slightly more populated areas, so that might be a reinfection of the cases. But if that were the case, we should have seen it across the board, and we didn't. So we believe that something to do with mass transit is a big thing. Some of you who've been on calls with me know I've been reporting this. That's going to be a big challenge for New York City. But for each individual company, look at how your employees are coming to work. Because if they're coming to work via mass transit, you know, if you want to protect your employees, maybe those are the employees who really can work from home. People, and you have, if you're doing staggered, people who are coming in will drive first. There are a number of different scenarios that we had a conversation with about yesterday, and be happy to share that with you at another time. So, what role is AI and ML playing right now? Well, immediately we can help by pinpointing areas that are going to open up, right? We can provide prediction models in various areas. Say when you reach a certain point, this will likely open up within 3 days or 5 days. We can also model the restart of economic activity. We know some counties and state regions are looking at how to simulate the economies opening up for various, let's say, retail shops, B2B businesses, logistics, and so forth, because they need to gather their tax revenue. So there are a few companies, your major corporations, in terms of your consulting firms, are doing a lot of modeling to help states understand their tax revenue implications, where they can get the money, and how everything will work. What's fascinating is there are a couple of competing ideas, but the one that seems to be gaining traction is actually to reduce the state and local taxes so that it will spur economic activity within areas, and there's been some studies that will actually show that. And so we know of a few people who are working on some models to do exactly that. More specifically for businesses, you want to look at what is changing in your current customer behavior. You want to try and analyze things like any text messages that you're getting, email messages, messages that are being left on your website about information, and compare it to what happened before. You also want to model this behavior moving long term. You want to see how this may have changed year to year, from last year to this year, to see if there are any effects on that behavior. For those in retail shipping, you may see an increase in the online orders and mobile orders. as opposed to people who are coming into the stores. But you may also likely see some problems associated with the delivery of other mechanisms. Like, are they looking for different times that you're open? Are they looking for, instead of coming at the normal time that they would on a Saturday, are they coming a little bit early? Are they coming later? All of those things will change, and your AI and ML algorithms will actually help you determine where these peaks are, as well as provide information to your customers on when's the best time to come, because they may want fewer people in the store and you can distribute them. So there are some real benefits to that. But we have a very interesting challenge right now, and that is this. There's been a lot of news that's been publicized about the models, and there is honestly some healthy skepticism of models, but there are also some problems with these models. And this is not really to show the problems of virus modeling or epidemiology, pandemic responses, and so forth. We know this occurs from a lot of the clients that we've worked with. We know this question arises. How do I know the model is correct? How can I trust this? The problem is that with all the news about how these models might be wrong, the uncertainty, the skepticism about whether artificial intelligence really works, that is going to be pervasive throughout any models that folks do. You create a revenue model, there's still going to be this thing inside people's head that say, wait a minute, all these great scientists were wrong on their virus models. How do I know this revenue model is correct? And so a lot of the data scientists, a lot of the people who work with data need to be very aware of this. They need to have that healthy skepticism. They need to respect the skepticism that will occur from folks who are retrieving these models. And it should make your data scientists and your data teams better at explaining, better at basically interpreting the results in a manner that will be much more easily understood and much more easily acceptable by the senior executive staff and so forth. But this is one area that we're watching actually very closely to see how AI and ML really become perceived. We know that there are some challenges, especially in healthcare, with like the IBM Watson. People did a study that said, well, do you trust online medicine, or do you trust this machine giving you a diagnosis and a treatment? And the answer was, well, sort of. We kind of like the fact that it does it, but I want a doctor telling me. So there is that skepticism and trust of these machine learning models, or these AI models, being correct. We also know that we've seen cases, unfortunately, with the self-driving cars. An Uber car was actually involved in an accident where it killed I think it was a pedestrian or a bicyclist out west. So this creates these problems for AI. We think in the long term, though, it won't be so much of a challenge. So where does this leave us in this post-COVID-19 world? So we identified 4 key areas where we think that this is going to be a key issue. The first is social distancing. Right now, from a policy perspective, you have to social distance, but that is going to have a lingering effect on the way people interact with each other, as well as interact with your business. It's going to completely transform the information that they want, the products that they want, and how they exchange payments with you, how they create commerce. The second major area is the work environment. For those of you who are in an office building or a larger office building, there may be a lot of changes associated, not just in the short term with rolling work from home and rolling work in the office, trying to figure that out, but also these may be permanent changes. You may see permanent changes where instead of a company needing 100 desks for an office, they'll only have 50, and they'll do this rolling, travel pods where you come in, you find a desk, you work, or we need to have a meeting. Another conversation that we had dealt with the fact that they'll have virtual offices, in different places, or the remote work. You may see smaller offices around a particular geographical area, and that will aid in this, let's say, movement of personnel. We also see the work environment being affected in warehousing. We might see additional artificial intelligence solutions being put into manufacturing and warehousing to limit the number of touches that people actually have with each other. There is some other work that's being done to collect information on employees, like their temperature, whether they had a cough, and so forth. We'll talk about those because there are some legal and privacy issues that enter into this. We also have identified there are new opportunities, and this is one of the areas in terms of like your opportunities from your SWOT analysis. there are significant opportunities for companies to engage new customers in a new way and actually gain market share. We know Amazon's doing a lot of this. We know some other firms are doing this as well. Instacart, we think there's a lot of Instacart-like clones, if you will, that will start appearing because there just wasn't enough people. And now that people know about it, there may be a lot of interest in the concierge services. Disruptor acceleration, we think, is also another one. We believe that new businesses and new types of businesses will open up to basically impact your existing business. So there are a lot of different things that will occur to transform an entire industry and the way the industry works. In order to do this, you're going to see challenges in rapid response in healthcare. Your projection models will need to be more accurate and need to run at a much quicker pace than they normally had. We were going to see a lot in logistics and optimization. You're going to see a lot of things about moving people, moving product, traffic type models like in-store traffic and warehouse traffic, as well as simulations. It's one of the things that we've been talking about for years, is that the use of simulations are really good, because if you're trying to make sure, let's say you have a supply chain and you have product and raw goods that you need to get from stage to stage to stage, you want to try and create your optimization models. But when you do that, you want to actually use simulations to figure out what if scenarios. What if we have a spike, let's say, or a decline in a particular area, say New York City? What is that going to do to our model? How does that work? What are the sensitivity traits of individual variables within the model? So there's a lot of good stuff within these last, two components that could end up having a significant impact on your business. So let's talk about some specific social distancing. There are really three key things. Number one is this social distancing policy. We don't think the social distancing policy is, number one, over in the near term. We think there's going to be longer term effects to that. We do have social distancing policy as a matter of public policy. We will see those probably from years to come. As the governments try and get their handle on certain things, you may see limitations on the number of people in restaurants, limitations on the number of people in stores. We'll also talk about that when we talk about the workplace. You may see limitations on the number of people that can be in there. For airlines, we'll probably see, you can't be so close to each other. They're going to probably mandate further space. I'm not sure how much space they're going to be able to do. But there's also going to be the voluntary social distancing. This is going to be people who have been affected by this COVID crisis. There's going to be people who are more interested in saying, I want to be safe. And so therefore, they will social distance themselves. They will not go into the crowded stores. They will look for the times when they can shop without having to be less than 6 feet away from each other. Or they are voluntary social distancing by ordering online more. They're asking for more concierge services. They're asking for businesses to come to them. So this is where the customer demands different types of services. And the AI and ML algorithms will actually help trend these items. They'll basically predict when certain areas might be looking for this or the type of people who are looking for this. And we can also see this as providing additional services for, say, the elderly who do not want to go out, who could be at risk for these types of viruses. So we can manage traffic into the stores with these items, and we're seeing algorithms already now to actually work with that. They work with the phones. So what will happen is that if you want certain things, you can put them on the list, and it guides you with the most optimal path to get there, where someone's talking about where there's the least amount of traffic, because if I have everybody with a phone, I know exactly where they are. I can increase connection with customers through these online and mobile needs. I'm actually pushing information to customers because I think I know what they need because they've purchased from me before. So I'm going to keep pushing not just recommendations, but I'm going to purchase baskets. Hey, this is a basket of goods that you might be interested in because you purchased from us. The enhanced delivery mechanisms, this is a big one. We're seeing more innovative ideas to deliver product, even deliver testing materials for COVID-19 remotely, where a drone actually goes to a place, drops a package off. UPS was trying this years ago, but now we saw the other day on TV that pizzeria is actually doing the same thing, and they're delivering up to the door, and it's an automated little truck that's actually doing it. Plus, you can use real-time data for replenishment at a customer level. So this is where we'll get to the IoT, Internet of Things, where more IoT devices out there will provide more information that can be used by your business for the purposes of getting the information out, getting the product out, and staying engaged with your customers. But this poses a challenge. It's not just about monitoring employee health, right? It's, when folks come in to a workplace, right? Uh, there's talk about monitoring their temperature. Did you have, a cough? Were you anywhere who was exposed and so forth? The employees still need to work. When you have that, what data are you going to collect and how? There's a legal and privacy issue for this, that no matter what you do, they're talking about the phones, where the phones are your immunization cards. There's a whole set of legal issues and privacy issues associated with this. But if you do collect that information, how is that data going to be stored? How is it going to be used? Because if you do have to terminate an employee, or there's a problem with an employee, they will say that you use that data, my private health data, in order to get rid of me. And it can open up, depending on the state, it can open up a number of challenges. But by collecting some of this data, you can predict and forecast who should stay home and alter work schedules, right? It's not just everybody work from home. It's, you can create, instead of the 5-day work week, you can do the 3-day work week. Monday, Wednesday, Friday, Tuesday, Thursday, work from home, or some rotating scale. But you can also do it based on the mass transit. You can do it based on hotspots. And it doesn't have to just be COVID-19. It could be for flu as well. Because by reducing the infections of even flu and COVID-19 and anything else that may come up, your insurance rates might actually go down, right? So insurance companies will actually probably benefit from that data that's collected, and companies that will comply with those types of schedules. For individual warehouses and distribution facilities, you can manage the workflow and foot traffic, because you can create simulations that will allow to understand how people move within an environment where they congregate, and make those congregation areas safe. And you can also safeguard your inventory. So the safeguarding of the inventory has to do with both fraudulent issues of inventory being removed by unauthorized removals, but also based on viruses. So some customers are very concerned with the fact that when they get a product, could that have the virus involved? By having these AI and ML type of algorithms, let's say for argument's sake, you're swabbing some information, you can predict, using that information, the quantity of items that may actually have COVID-19, and you can develop policies to say, if they come from this area, or here's a particular area, or this is what's causing any type of infection, it can actually predict where those are by using that data. So new opportunities, there is going to be tremendous opportunity in customer behavior, because it's going to change. So your AI algorithms can identify the changing purchasing habits. How are they purchasing? Mobile, online, television, any other way? Where will they purchase? Instead of large aggregate stores, do I need to create smaller stores and move the product to where they're going to be? When will they purchase? Do I have to have different hours? Am I going to have to do different things at different locations? And we can predict and model these habits based on that and identify gaps. So with regards to payments, another thing that's changing are the payments. The customer payments will change because now the credit card companies are providing the touchless credit cards, where you don't, and it's paid in through your phone. So you're going to see a lot of changes in payment systems, and the AI solutions can help interact with those payment systems to figure out what is actually customers like and don't like. With new acquisitions, your customers can gravitate towards safer businesses. If you're promoting your AI and ML algorithms for this, where you can identify sentiments and attitudes of new customers, you can actually then determine which customers will gravitate towards you and which ones might leave. And it will also help you develop your own internal policies and your own marketing strategy to handle this. Finally, on disruptor acceleration, we're seeing the increased automated delivery systems, enhanced mobile use. You can use your AI algorithms to help customers find products. In this particular situation, you had the surge of purchasing, and they've been modeling these waves. That the first wave was toilet paper that was going. Now they're talking about hair dye and grooming products are in short supply. We're talking about disruptions in the supply chain. The AI algorithms can help customers find products from different locations, instead of having them actually go out to the Amazons of the world and to the Whole Foods and other stores to try and find their product. There might be solutions out there which will find the products for them through the entire supply chain. It's this aggregated supply chain. And the machine learning and optimization algorithms will help make a supply chain even faster. This will actually preclude the need for the cloud-based data solutions. You need cloud-based data solutions in order to do that, because you'll also need to increase the data cooperation between companies. So one of the things that we think is going to be a new era for this, because we've seen this in the automotive industry, where BMW, Mercedes, and a few others are sharing data between cars. So, and they share that data to make the driving experience better. So we think this era of data cooperation will gain more and more traction, and it will allow you to build more algorithms to help your customers and help your product line and help your supply chain at the same time. So what does all this mean when we leave here? This means that organizations must become more data centric. So even if you're data centric right now, you're probably not as data centric as we think you're going to need to be. Because the more data centric you are easily able to identify the risks and challenges and develop your risk mitigation strategies. Are you ready for the next pandemic? What does that mean? Do you have the right supply at any given point in time? How can you ramp up? Where would you ramp up? Where would your workers work? All of this information should be collected so that you can then create these predictive models to help develop these risk mitigation strategies, your disaster recovery plans, and enhance your overall capability. There are some specific AI solutions. I'll just go through a few within each, and if you want, I can provide these later for you. But in the finance area, things like commercial real estate, changing work patterns where people will not need larger offices is going to affect commercial real estate. Smaller offices mean a little smaller targets in multiple areas. So there's going to be need to identify the best areas for investment. Less contact with people means you're going to have more fraud. If I could do my loan applications more and more remotely, I don't have to go in, I don't have the signature. What about my ID? You're going to have more fraud within the marketplace that needs to be looked at. Beyond the normal economic challenges, we have retail banking, contactless banking. How do I work with my banker without actually being there? And a final one, which is important for cloud-based companies, is there's going to be the demand for more unstructured data for your natural language processing, for information around the world to start identifying different hotspots. What's the trend? What's happening? And this will need to be done in multiple languages. In the healthcare space, we have epidemic response, obviously, that's going on. We need better data collection, more advanced modeling, and we need to do a better job in that area, because one of the challenges we think that occurs is like the hurricanes. When a hurricane comes and it's about to hit, you have a group of people say, oh, it's not going to hit me. Then it turns and they say, see, I was right. That leads to an insensitivity among customers or amongst the population about those models. So there's a real importance to not only get it right, but to convey where it may or may not be wrong. Telehealth will be huge. Right now, this wave of doing telehealth, we do not think is going to go away. It's going to decrease costs for doctors. It's not going to necessarily decrease quality. It might actually increase quality because you'll be able to stay at home and get treated as opposed to going to a hospital or a provider's office. However, there are some areas in telehealth that they have to look at, and specifically deals with fraud, where doctors say they saw a patient when they didn't. So they need to monitor that as well. This leads to the concept of data interconnection. Again, just like we talked about with the other industries, the hospitals need to be more integrated with their data, not necessarily at just some electronic health exchange, but they need to have more interconnection between them almost directly. And so that's something that we're seeing some movement as well in some of the other magazine articles. You're going to have advances in treatments, and then natural language processing is a huge area for healthcare, because you will be able to analyze comments from patients, nurses, and doctors for better care, to understand what's really going on. What are the key words? You know, they talked about with COVID-19, people started reporting, loss of smell and a loss of taste. Well, if that was somewhere in notes, the AI and ML could probably pick that up. But if you have your traditional EHR systems where you just have checkboxes, if you don't have a checkbox for loss of sense and smell, you can't find that. So we think there's going to be a huge area of natural language processing that's going to increase. If you're in the retail business, your customer traffic is going to change greatly. You're going to have to manage your flow of customers in retail stores. They might look to minimize contact points. Instead of funneling everybody into one particular retail cashier, you might have to spread them out and allow people to migrate using their phones to tell them which one is the best place to go to. Automatic replenishment, stores can predict purchases and have products on hand to minimize surges. They can also share replenishment areas just like a warehouse does. AI delivery, automatic delivery of products, prescriptions, and groceries. This could be done obviously through the traditional sources or through others. Another one's the virtual reality experience to enable customers to experience products prior to purchase. So this is an interesting one. It's not so much an AI, ML, but it kind of falls, virtual reality does fall within AI technologies, especially if you allow them to change and you can modify their experience as they're working it. And then enhance customer service and targeting, which should be obvious. Now, with technology, if you're in the technology space, there's an increased data requirement. You're going to have to create these larger repositories, collect information. There's going to be requirements for different types of data. Shared repositories, we think, will become much more prevalent. The ability for companies and organizations and industries to share data, non-sensitive data, but shared data, is going to be critical to responding to crisis like the one we're seeing right now. Augment existing services. Customers are going to look for AI solutions from vendors to provide competitive advantage. They're not necessarily going to have the skill or the wherewithal to build their own, but they're going to look for competent and accurate and acute AI solutions that they can embed within their organization. For managed services providers, predicting outages, this is key. Some of the managed services providers may have seen an increase or an uptick in cybersecurity issues or cybersecurity related attacks. And that's because some external entities are trying to increase their attacks because they believe that the guard is down. But you can also use this to predict outages and slowdowns, but you can also provide insights to your customers in changes in activity. Bandwidth is increasing, the number of clicks are increasing, the bandwidth is increasing, number of requests are increasing, not just for your company, but for a lot of companies, and this may mean something. MSPs could be a first line of defense in understanding what's actually happening. In fact, even in the recovery, we think one of the things will be also with MSPs is looking at the network bandwidth traffic, looking at the increased traffic associated with economic activity. New solutions as well can be created. We know a couple of companies, Brandon Systems in Farmingdale is actually creating software to track COVID cases in a crisis management software. And that's something that can be used by companies or counties and so forth. These are types of solutions that will occur. And then increased partnership skills held by tech companies can be shared. We can share this AI and ML skill set to enhance the overall experience. And finally, in manufacturing, we think a couple things. We think simulations are going to be much bigger in manufacturing than anywhere else to increase so the work traffic pattern in warehouses, as well as simulate the flow of product through their supply chain. We know that 3M is having some issues with their supply chain. It is fairly antiquated in its scheme, not in the technology behind it. The problem is they need to consider different ways of operating, and I think they're in the process of doing that. New products can be created using AI and ML. Why? Because you're looking at the different attributes. You can simulate and aggregate the information of folks, of customer behavior. Direct delivery. Manufacturers may not need to go through a distributor or a wholesaler. So this disintermediation that occurred with e-commerce at one point and then came back could actually go away again, in the sense of, if I'm looking for product, I can get it directly from the manufacturer and figure out different logistics systems to get it to my company or get it directly to the consumer. So in other words, you have your warehouses, instead of having real warehouses, you have mobile warehouses, which are trucks. Truck driver has everything on a pallet or everything in there, and he can deliver the various products that they need to deliver to various customers. No different than a UPS. And automation warehouses will increase their use of AI in their warehouses and in their distribution facilities to move products, thereby reducing contact between employees. So, and finally, our recommendations for any company, regardless of the industry you're in, to be prepared for not just the next crisis, but the changing world. Number one, collect more data, and more and more. Look for opportunities to collect more data. Storage space is pretty cheap right now, but the idea is to collect as much data as you can, because it will help really reveal insights for you, both in the way you operate as well as in the way your customers are operating with you. The complexity of new data requires reevaluation. It really means that you have to look at your data repositories and determine whether or not they are sufficient, in some cases necessary, because you may have some data that's really just not not structured properly, and you have to redo that area. Data lakes will become important. Gathering raw, unstructured data is really, really important because it's going to allow you to do some insights in the natural language processing, artificial intelligence area, to actually really compute different opportunities that may exist or identify hotspots that may occur with these new crises or economic uptrends and downtrends. Number three, develop a data analytics strategy. We know a lot of companies that have a very good data strategy, but it's not really complemented with a data analytics strategy. Do you have the right analytics in place? Do you have the right AI machine learning in place? Doesn't mean you have to build out your data science organization. It does mean that you need a strategy behind what is involved in my data science, what partners am I working with, what other companies that are in my space that I'm going to work with, that we're going to collaborate with to create this analytics strategy, both at a near term for things like individual regions and closure, openings and closings, model changes in your current customer behavior. We could see that across the industry. And then longer term is, how these trends change. What happens if there's another crisis? Can we predict when it occurs? Can we predict if the change will go back to the way it was? These are all unknowns. Number four, use more touch point data services. So internally, you have a lot of data that is somewhat being collected by systems. Some are in Excel spreadsheets because your folks are pulling data from different marketing sources and so forth, but they're not aggregating that information in a cohesive way. Two is use the IoT, use like Internet of Things to identify for folks what's going on. We think there's going to be a lot more with things like refrigerators, where refrigerators are going to be able to tell what's inside of it. We know that the refrigerators are getting smarter, but consider if a refrigerator has a device that can tell what's in it, and within the packaging of a product, it has an RFID or some other type of signal that can actually tell the refrigerator, I'm in here and here's how much product I have. That information can be collected, aggregated, and sent to the various retailers to say, I'm running low on a particular item, or I've had it for 3 days, it's probably going to expire, so I need to let you know that you should have another one. For like water delivery or any other type of deliveries, IoT can actually be used quite well to manage in-house inventory, personal inventory, as well as your warehouse inventory. What cars are out there, devices, computers and so forth that can constantly send this information. Gather data from ancillary unrelated services. So we're talking about this virus epidemiology type of modeling. It might be good for your company to actually collect this data and incorporate or at least monitor various models associated with COVID-19. What will then happen is you can look at your revenue curves and match the two and see where, at what point, how much is a lag, when does certain pieces hit, in terms of opening or not opening. Those are all very important. And finally, as we said before, we think using simulations are really, really important. So we advocate a lot of companies to learn how to do simulations, how to create, they don't have to be very extravagant simulations like, designing a rocket ship. It could be very, very simple simulations to model the flow of product or food from one place to another, or model the traffic that comes into a website, and look and see what happens during various times so that you can build a disaster recovery plan and a business continuity plan that includes simulated models, not just let's move everybody from one site to another and let's see if we can operate from there, because it assumes normal operation when that may or may not be the case. Simulations can also provide insight into uncertain scenarios, high peaks, and high and low valleys of various demand and surges, and how you should respond or could respond to those types of peaks and valleys. And if you combine these things with other simulations, you can really create a very robust supply chain kind of like algorithm and know all the sensitivity traits associated with various aspects of your business. And so in conclusion, one of the things that we're saying is that you're going to be more data centric than you ever were. You definitely need to get more data from different touch points, both with the customer and away from the customer. And when you pull all that together, you want to basically have a strategy to use it. And there are a lot of different ways, and for some companies, it makes more sense than for other companies. But at the end of the day, it's knowing what you want to do with it. A lot of companies will be using various AI and ML techniques. We don't see that changing. We think it's going to enhance, and we think that ultimately is going to be a differentiator for companies trying to survive the current economic crisis, survive it in the midterm, and as well as thrive in the long term. So that kind of concludes the presentation. Does anyone have any questions they'd like to ask?
That was good stuff, Alex. Thank you very much for sharing that today.
You're very welcome. Who was that?
That was Michael.
Hey, Michael, how are you?
Thanks. Insightful. I took a couple of notes. I'll be passing that along internally.
If you'd like the information from here, just shoot me an email. Anybody who would like it, just shoot me an email, and I'd be happy to send you the slides here. Again, if you would also like access to the data that we're pulling from a number of sources, we can also talk to you about getting you that at no charge as well.
Awesome. Thank you.
Hey, Alex, this is Sid.
Hey, Sid, how you doing?
Good. So, what sources of publicly available data would you be using or could use to, track some of these scenarios that you've spoken of?
Specifically on the COVID crisis?
Specifically on COVID, and let's say you had mentioned, for example, New York City potentially being the last city to open up, right?
Yep.
So that brings up a couple of questions. One is that what does open up really mean? And
right.
Second is, New York is, given how dynamic it is, given the population, it's going to open up, and there's going to be the activity is going to jump very quickly, right, when it does. So even in a partial state of opening up, it's still going to be pretty heavy.
That's correct. Yep.
So all that said, along those lines, what does opening up mean, and what data would you use to track some of that?
Okay, so let me answer the data question first. So there are a couple of data sources that we use. We're getting information from the CDC. We're getting another one from COVID tracking and the European CDC. Those are three primary sources that we've got. Along with, we do get information from New York City. So New York City provides their own direct information. Getting it lower than a county level, or like the Nassau County that I showed you, is a little bit more difficult. Some of it is actually being tracked by hand, but it's a little bit harder to do that and make sure that it's consistent. But we're working to try and do that as best as possible. Now, in terms of open, when I use the word open, I mean fully opened at the end. It's like, how is everything going to open? It's going to open in those stages, and within those stages, there will be smaller pieces. The larger cities, I think you're going to see restrictive policies put in on certain openings to prevent people from utilizing certain services. So, for example, they're going to close the beaches, they're closing the pools. They don't want people to aggregate unless they know they have a way to mitigate the disease. That is going to be very much a city by city. So let's say you're looking at particular venues. I'll use that term, Sid, without saying more in detail, but let's say you're looking at particular venue areas. The state departments should have that information available. Some city areas should have the information available, and you would be able to trend based on the numbers, based on a few cities, of how they open up, the first few, how other people will open up. Because if something works, they're going to try and follow that as quickly as possible. Does that answer the question? Because there was a lot to your question, and I'm not sure if I got through all of the pieces.
Yeah. So one of the things we're exploring is also using traffic data patterns, right? So is traffic increasing in general, and that can be a proxy of activity and opening up, and comparing it to prior levels. Assuming it probably never goes back to the same, but that's the sort of area we're exploring in order to understand health and opening.
Yep. And that's a great example of ancillary data sources, using those items as a proxy for for information or for insights into other areas. Is the traffic moving up? You can also, another interesting thing would be, this is more anecdotal because it's hard to get this particular data, but if you have less shortages in particular areas, your activity is probably normal. Does that make sense?
I'm sorry, can you repeat that? If there's less
shortages It means
Huh.
that your supply chain, meaning the demand and the supply, are in balance, meaning the economic activity has come back into balance. You follow?
Right. But how would you gauge shortage?
So if it's really on reports of shortage, right? Remember we talked about unstructured data, right? So people will say, I can't find toilet paper, I can't find hair products, or I can't find this. And you'll get that from newspaper articles or from magazine articles in a particular area. So let's say you're looking at a venue, let's say we're talking about Major League Baseball. And Major League Baseball is trying to figure out that they're going to play in Arizona. They want to know when Arizona is going to open up. So if economic activity is going back to normal, one of the things they could do is analyze, various local newspapers and just harvest that data and look for both sentiment as well as things specific to shortages. Is there anything related to a shortage of product? Yeah, because we see them in the news, right? In local newspapers, they say, we're still seeing a shortage of this, or now this is the new shortage. So economic activity hasn't really returned to normal. That's kind of like an example. Does that make sense?
Yep, understood.
Any other questions out there?
Okay. Yep. I'm a lecturer and researcher at university. Can I contact you regarding getting the data?
Sure.
How the company using the data in their corporate governance and
Sure. I'd be happy to. I'm going to send you my email address. You will have it, and I'll be sure to. You probably have it in the email, but you can send me an email address as well, and I can easily talk to you about research for that as well.
Oh, awesome! Thank you.
And thank you for joining from New Zealand at 4 a.m.
Yeah, it is 4 a.m. here.
I appreciate that.
Yeah, it's very interesting and informative.
Are there any other questions out there?
Yeah, first, I would like to thank you, Professor, for this wonderful presentation. I have beside bad news about COVID-19, I have just different perspective with regards to this issue. It is good to hear this. First, my question is that data protection is a very complicated issue, and there are some specific regulations specific to this topic, especially between USA and European Union. This is a very controversial topic. So I wonder if the effect of the possible new regulations are going to be included in these artificial intelligence models.
That's a great question. And it's hard. It's really, really hard to assess that. And I'll tell you why. The rules are kind of different, right? Especially with things like, your GDPR and your healthcare data and so forth. The rules are different in Europe than they are in the United States. And it's, you're going to need to share data somehow, but they'd have to trust each other that they're not going to utilize the data in a bad way. I don't see that happening that way in the near term, but they'll figure out ways to aggregate some data. We have a lot of statistical techniques that do not require the actual raw data. From meta-analysis techniques to obviously covariance techniques, there are many things that you can do that do not require the raw data. I can see a lot of that increasing significantly, though.
Thank you so much.
Are there any other questions out there? Okay, I think we are almost out of time. What I will do is in the chat window here, I will put in my email address for everybody, and you'll be getting a survey. Would love to hear your thoughts on this very shortly, because if you sign up with Eventbrite, you'll actually get that. I hope you guys have a wonderful and safe day, and we'll be hosting another one of these webinars with a different topic in probably 2 weeks. If you've got no other questions, again, thank you very much. Have a wonderful day and be safe.